Colin, before we went to break, you were mentioning other systems around the world, and I think that's a really important caveat in this discussion because much of the healthcare debate in Canada is framed in a binary way between Canada and the United States. Can you explain to viewers what other systems look like in practice when they combine both private and public care?
Well, yeah, there's lots of different ways you can do it. And Canada should be looking at countries that are providing better healthcare results to patients and trying to figure out how we could copy those best ideas and bring them to our country. But as you mentioned, too often it comes down to either the US system or ours. There's 200 countries on the planet. We need to be looking at what some of the top dogs are doing.
And really quick, just on that note, when you say better, what do you mean better? What does better healthcare, like what metrics do you use?
Better results for patients.
Okay.
Quality care with much shorter waiting lists. I mean, that's one of the most important things. If you're a patient, you want to have your problem treated ASAP. You don't want to be waiting long periods on waiting lists. But unfortunately, Canada trails the developed world when it comes to providing quality care in a timely fashion. So, we could be looking at what Australia does, where they have the public system and patients can also opt out or choose private options if they want to. Norway takes a similar approach. There's lots of countries that are providing, like I say, better care to patients, and they're doing it much better than Canada. In many cases, they're actually spending less money too. So they're getting better bang for their buck than what we have in Canada. But we really haven't seen much in the way of health reform over the past 30 years. And that's costing patients. It's costing them quality of life. In some cases, it's actually costing patients their lives. And it's very tragic. But, now's the time for governments to get serious about improving the system.
And Ash, in your, what I think is a very well articulated op-ed where you talk about this, you kind of urge the Ford government to repeal the Private Hospital Act, but they wouldn't be the first government to actually reevaluate the legislation. Is that correct?
Correct. So as recently as 2018, under Kathleen Wynne's Liberal government, there was an attempt made to repeal that very act whole cloth. But there was intense lobbying pressure, as was expected, by the healthcare industry, especially the unions within the healthcare industry, the government unions. And they were successful, and they boasted openly about their success in repealing this attempt at introducing private hospitals to Canada. So all I'm asking is for Doug Ford to have the political courage of Kathleen Wynne when it comes to privatizing or introducing private options for our healthcare system in order to expand capacity.
And what's the argument against doing so?
Against introducing private options?
Yes.
So the classic argument is that for-profit healthcare doesn't have the same incentives as government-run healthcare. But this is a false dichotomy. Private-run healthcare can be for-profit or it could be not-for-profit. The for-profit, not-for-profit distinction is available to private healthcare systems. In the United States, we have hospitals that are not-for-profit and hospitals that are for-profit. What is most important is that by allowing private hospitals to be built in a truly, I want to emphasize, a true free market sense. And the United States does not have a true free market when it comes to private hospitals because they have the so-called certificate of need paperwork that existing hospitals in an area have to fill out in order to say that they should allow new hospitals to be built. Imagine if McDonald's had to sign off on paperwork saying that this neighborhood could use another Burger King. That's not what I'm advocating for, not the US system. As Colin pointed out, there are more systems to look at. But just having the option of a private funder to build and run their own hospital without government interference or without government permission, but to provide more beds and more doctors, more nurses, and other frontline support to our ailing, fragile system.
So we have about 40 seconds left here, Colin. This doesn't sacrifice universality in any way, does it? Because I can assume that critics would argue it does.
No, it wouldn't at all. You can keep the public system and allow patients to choose private options if they want. And some of those patients will. A lot of patients won't. They'll stay with the public system. But those who do, they're coming out of the government's waiting lists. So then those waiting lists get to be a little bit shorter. You might have a few people fewer in front of you in line if you're waiting for your hip surgery or whatever it is.